Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into a topic that affects countless dog owners and their beloved companions, cataracts. If you've ever looked into your dog's eyes and noticed a hazy, cloudy appearance where there was once a clear, dark pupil, you may have seen a cataract. They are, in fact, the leading cause of impaired vision or even total blindness in dogs. But what exactly are they? Why do some dogs get them and not others? And most importantly, what can be done about them? Over the next while, we'll explore the science behind this condition, from the different types and their causes to the latest in medical and surgical treatments, all based on recent veterinary research. So, let's get started on our journey into the world of canine cataracts. First, let's define our terms. What is a cataract, really? Strictly speaking, a cataract is any opacity or loss of transparency of the lens or its capsule. To understand what that means, we need to talk about the lens itself. The lens is a remarkable, normally crystal clear structure that sits just behind the iris, the colored part of the eye. Its main job is to focus light onto the retina at the back of the eye, much like the lens in a camera focuses light onto a sensor. This lens is about 65% water and 35% protein. Its incredible transparency comes from the highly ordered, precise arrangement of these proteins called crystallins. The lens is also a living structure, encased in a delicate capsule, and it grows throughout a dog's life as new lens fibers are produced near its equator, or its middle. The older parts of the lens are pushed toward the center, forming a denser core called the nucleus, which is surrounded by the softer cortex. Because these fibers can't reach all the way from the front to the back of the lens, they meet at junctions called sutures, which often form a characteristic Y-shape. When anything disrupts the perfect arrangement of these proteins or the delicate balance of fluid within the lens, be it genetics, disease, or simply age, the lens can lose its transparency, and that opacity is what we call a cataract. Veterinarians classify cataracts in a few different ways to help understand their cause and predict their behavior. One way is by their stage of development, which describes how much of the lens is affected. An incipient, or early, cataract involves a very small, localized opacity, covering less than 15% of the lens volume. Next is an immature cataract, where the opacity is more significant, covering more than 15%, but you can still see the colorful tape towel reflection from the back of the eye when you shine a light in. A mature cataract is when the entire lens becomes opaque, completely blocking that tape towel reflection and causing blindness. Finally, a hyperature cataract is a long-standing cataract where the lens material begins to break down and liquefy, sometimes causing the lens to shrink and the capsule to look wrinkled. Now for the big question, why do dogs get cataracts? The answer is complex, as there are many different causes, or etiologies. The single most common cause in dogs is genetics. Many purebred dogs are predisposed to developing inherited cataracts, which often appear when the dog is a juvenile or a young adult. These are typically bilateral, affecting both eyes, though not always at the same rate. The specific characteristics can vary dramatically by breed. For example, golden retrievers are known to get posterior subcapsular cataracts, which often appear as a small triangle at the back of the lens and tend not to progress, meaning surgery is rarely needed. In stark contrast, the inherited cataracts common in American Cocker Spaniels often affect both the front and back of the lens cortex and can progress very rapidly, making early surgical intervention a high priority. A large-scale retrospective study in France identified the Yorkshire Terrier as being significantly overrepresented for cataracts, while a similar study in North America over a 40-year period found the highest prevalence in breeds like the Smooth Fox Terrier, Havanese, Bichon Frise, Boston Terrier, and Miniature Poodle. The good news on the inherited front is the incredible impact of responsible breeding and genetic screening. In the United States, the American College of Veterinary Ophthalmologists and the Orthopedic Foundation for Animals jointly operate the Companion Animal Eye Registry, or CAR program. This program allows board-certified veterinary ophthalmologists to perform screening eye exams on breeding dogs to identify inherited conditions. The findings are guided by a document often called the Blue Book, which lists disorders presumed to be inherited and provides breeding advice for each breed. The goal is to reduce the incidence of these painful or vision-threatening diseases. And it's working. Thanks to these serial screening examinations and the dedication of responsible breeders, the incidence of certain inherited ophthalmic disorders has measurably decreased. For example, the incidence of nuclear cataracts in German Shepherds presented for screening exams dropped from 6% in 2013 to 4.3% in 2022. Similarly, the incidence of posterior polar cataracts, a specific inherited type, has decreased in golden retrievers, cocker spaniels, and Siberian huskies over the same period. This is a powerful testament to how proactive, evidence-based breeding practices can improve the health of our dogs for generations to come. Of course, not all cataracts are inherited. Just like in people, cataracts can be associated with advancing age. These are called senile cataracts, and they often affect the nucleus of the lens. It's crucial not to confuse senile cataracts with a much more common age-related change called nuclear sclerosis or lenticular sclerosis. Nuclear sclerosis is the hardening and compression of the lens nucleus that happens as new lens fibers are laid down over the years. This is what gives older dogs that bluish, hazy look to their pupils. However, with nuclear sclerosis, vision is not typically impaired, and a veterinarian can still see the retina clearly during an eye exam, which is not the case with a true cataract. One study found that age-related, or senile, cataracts are most often in the incipient stage and tend to progress very slowly, if at all. In fact, nearly 70% of them remained stationary over the course of the study. This observation about age-related cataracts leads us to a fascinating and much broader topic, the link between cataracts, body size, and lifespan. A remarkable study looked at data from over 100,000 dogs across 72 different breeds and found some striking correlations. First, it confirmed what many have observed anecdotally. There is an inverse relationship between body size and life expectancy in dogs, meaning larger breeds tend to have shorter lifespans than smaller breeds. But the really interesting part was the connection to cataracts. The study found that the incidence of age-related cataracts was directly related to the breed's relative life expectancy. Smaller dog breeds, which live longer, had a lower prevalence of cataracts in middle age and over their lifetime compared to giant breeds, which have shorter lives. This suggests that age-related cataracts could be considered a biomarker not only for life expectancy, but also for the cumulative systemic damage produced by oxidative stress over a lifetime. In other words, the same factors that contribute to a shorter lifespan in larger dogs may also be contributing to an earlier onset of cataracts, giving us a visible clue into the fundamental processes of aging itself. Perhaps one of the most dramatic and well-known causes of cataracts is diabetes mellitus. In fact, cataract formation is the most common ocular manifestation of diabetes in dogs, and the majority of diabetic dogs will develop them. What is particularly startling is the speed at which these cataracts can develop, often progressing to blindness within just days to weeks. Some owners even bring their dog to the vet for sudden vision loss before the classic signs of diabetes, like increased thirst and urination, are even noticed. The science behind this rapid onset is a clear example of how a systemic disease can wreak havoc on the delicate environment of the eye. The lens primarily gets its energy from glucose, which it pulls from the aqueous humor, the fluid in the front part of the eye. When a dog is diabetic, the glucose levels in its blood and, consequently, in the aqueous humor, are very high. The lens's normal metabolic pathway for glucose gets overwhelmed. The excess glucose is then shunted into an alternative route called the sorbitol pathway. In this pathway, an enzyme called aldose reductase converts glucose into a sugar alcohol called sorbitol. Here's the problem. Sorbitol cannot easily diffuse back out of the lens. As sorbitol accumulates inside the lens fibers, it creates a powerful osmotic gradient, essentially turning the lens into a tiny sponge that pulls water into itself. This influx of water causes the lens fibers to swell and eventually rupture, destroying their highly ordered structure and causing the lens to rapidly become opaque. This process is what creates the characteristic appearance of diabetic cataracts, with equatorial vacuoles and prominent water clefts, which are separations of the lens fibers along the suture lines. Finally, cataracts can also arise from other causes. Trauma to the eye, either from a blunt blow or a penetrating injury, can damage the lens capsule and lead to an opacity. They can also be secondary to other chronic eye diseases, such as progressive retinal atrophy, where degeneration of the retina leads to subsequent changes in the lens, or chronic uveitis, which is inflammation inside the eye. Less commonly, they can be congenital, meaning a puppy is born with them, sometimes in association with other developmental eye abnormalities. So, once a dog is diagnosed with a cataract, the next pressing question for any owner is, will it get worse? The answer depends heavily on both the stage of the cataract and its underlying cause. A comprehensive study that followed hundreds of dogs gave us some valuable insights into progression. Overall, the study found that just over half of all cataracts, about 55%, remained stationary during the study period, while 45% progressed. Progression varies significantly by stage. Perhaps counterintuitively, it's the immature cataracts that are most likely to progress, with nearly 73% of them worsening over time. In contrast, incipient cataracts are the least likely to progress, with only about 34% showing any change. This might explain some interesting findings from another study we'll discuss later on medical management. Progression also depends on the cause. As we mentioned, senile cataracts tend to be very stable, with about 70% remaining stationary. Hereditary cataracts, however, are more of a mixed bag. While just over half stay the same, about 47% do progress, and they have the potential for rapid progression in some cases. And, as we've discussed, diabetic cataracts are known for their potential to progress extremely quickly. Worsening opacity isn't the only concern. A major issue with developing cataracts is the risk of complications, which occurred in over 43% of eyes in one study. The frequency of these complications increases dramatically as the cataract develops, being least common with incipient cataracts and present in 100% of eyes with hypermature cataracts. By far, the most common and significant complication is a condition called lens-induced uveitis, or LIU. This is inflammation inside the eye that's triggered by lens proteins leaking out of the capsule as a hypermature cataract breaks down and is resorbed. This inflammation can be subtle, sometimes only showing up as a pupil that is resistant to dilation or a slightly lower intraocular pressure, but it can also be severe. LU is particularly common with rapidly progressing diabetic cataracts and can significantly decrease the success rate of surgery if it's not well controlled beforehand. Other serious complications can include glaucoma, or high pressure in the eye, retinal detachment, and lens instability or luxation, where the lens actually dislocates from its normal position. This brings us to the crucial topic of treatment. What can be done for a dog with cataracts? This is where the conversation splits into medical management and surgical intervention. Many owners understandably ask if there are eye drops or supplements that can prevent, slow, or even reverse cataracts. This is an area of active research, particularly focusing on the role of antioxidants. We know that oxidative stress and damage from reactive oxygen species are believed to be a primary factor in the formation of senile cataracts. This has led to the development of oral antioxidant supplements designed to support eye health. A fascinating retrospective study analyzed the medical records of dogs with senile cataracts to see if these supplements made a difference. The study looked at two commercially available products, Ocular and Mellitus IR/C, and compared dogs taking them to a control group taking no supplements. The results were nuanced and very important. For dogs with incipient, or very early, cataracts, the study found no significant delaying effect from the antioxidants. The cataracts in the supplement group progressed to the immature stage at about the same rate as the control group. However, the story changed for dogs that already had immature cataracts. In this group, both Ocular and Mellitus significantly delayed the progression from an immature to a mature cataract. The hazard ratio, which is a measure of risk, was significantly lower for both supplement groups compared to the control group, meaning they were much less likely to progress over the same time period. Why the difference? The researchers theorized that because incipient cataracts naturally progress very slowly or not at all, it's difficult to statistically measure a delaying effect. In contrast, immature cataracts tend to progress more actively, making the beneficial effect of the antioxidants more apparent and statistically significant. While this was a retrospective study with some limitations, it provides the first clinical evidence in dogs that while antioxidants may not be a magic bullet for early opacities, they could be a useful tool to help slow the progression of more advanced, immature senile cataracts, perhaps buying valuable time for dogs that are not immediate surgical candidates. While medical management may offer some help in specific situations, it's important to be clear that cataract surgery is considered the only definitive treatment to restore vision. Over the last few decades, the techniques for this surgery have advanced dramatically, and today, it is a highly refined procedure with a very high success rate, often 95% or better in uncomplicated cases. A key question is when to perform the surgery. There is a lingering misconception that you should wait until a cataract is ripe or fully mature. However, modern veterinary ophthalmology strongly advises against this. In fact, the success rate is higher and complications are fewer when surgery is performed early in the course of a progressive cataract. As we've discussed, allowing a cataract to progress to the mature or hypermature stage significantly increases the risk of lens-induced uveitis and other secondary changes that make the surgery more technically demanding and can adversely affect the outcome. So, what actually happens during modern cataract surgery? The procedure of choice today is called phacoemulsification. This is a true microsurgical technique performed under general anesthesia, using a high-powered operating microscope. To ensure the eye remains perfectly still, a neuromuscular blocking agent is often used, which means the patient will be on a ventilator during the procedure. The surgeon begins by making a very small, clear corneal incision, typically only about 3 millimeters wide. A special gel-like substance, called a viscoelastic material, is then injected into the front chamber of the eye. This material is amazing. It protects the delicate inner structures of the eye, like the corneal endothelium, and maintains the space inside the eye so the surgeon has room to work. The next step is perhaps the single most difficult and critical part of the entire operation, the capsulorhexis. The surgeon uses a tiny cystotome needle or forceps to create a perfectly continuous, circular tear in the anterior, or front, part of the lens capsule. The goal is to remove a circular piece of the front capsule while leaving the rest of the capsular bag completely intact and strong, with no jagged edges that could tear further. With the capsular bag open, the phacoemulsification handpiece is inserted. This instrument has a tiny, hollow titanium needle at its tip that vibrates at ultrasonic frequencies. Using short bursts of this ultrasonic energy, the surgeon carefully sculpts and breaks up the lens nucleus and cortex into small, manageable pieces, which are then simultaneously aspirated or vacuumed out of the eye. Many surgeons use a divide-and-conquer technique, where they sculpt deep grooves into the lens to crack it into quadrants before removing each piece. After all the cataractus lens material has been removed, the surgeon uses a different handpiece for irrigation and aspiration to meticulously clean out any remaining soft cortical material from the inside of the capsular bag, polishing the capsule until it is clear. Now, the capsular bag is empty. If left this way, a condition called aphakia, the eye would be extremely far-sighted, or hyperopic, by about 14 diopters. The dog's visual acuity would be drastically reduced, estimated to be worse than 2800. This is where the final, crucial step comes in, the implantation of a prosthetic intraocular lens, or IOL. A small, artificial lens, typically made of a special acrylic called polymethyl methacrylate, is carefully folded and inserted through the small corneal incision and placed directly inside the empty capsular bag. For most dogs, an IOL with a power of about positive 41 diopters is needed to restore emmetropic, or sharply focused, vision. Once the IOL is perfectly centered, the viscoelastic material is removed, and the tiny corneal incision is closed with absorbable sutures, often finer than a human hair. Like any surgery, there are potential complications. The ultrasound energy and fluid turbulence inside the eye during the procedure can cause some damage to the very delicate, non-regenerative layer of cells on the inside of the cornea, known as the endothelium. Studies have shown that eyes with a shorter axial length, meaning smaller eyes, and those that require a longer phacoemulsification time are at greater risk for this type of cell loss. Postoperative inflammation is also a given, which is managed with a regimen of anti-inflammatory eye drops. One of the most common long-term issues is something called posterior capsular opacification. This is where residual lens epithelial cells migrate onto the back of the capsular bag that was left in place, causing it to become cloudy over time. This is sometimes called a secondary cataract, and in many cases, it can be easily treated with a quick, non-invasive procedure using a special laser to create a clear opening in the hazy posterior capsule. In conclusion, cataracts are a multifaceted and significant cause of vision loss in our canine companions. We've seen that their origins are diverse, ranging from inherited predispositions that dedicated breeders are actively working to reduce, to the rapid onset associated with diabetes and the slow, steady march of age. We've learned that different types of cataracts behave in different ways, with some progressing rapidly, while many others remain stable for years. While antioxidant supplements may offer some benefit in slowing the progression of immature senile cataracts, the gold standard for restoring vision remains surgery. Modern phacoemulsification with the implantation of an intraocular lens is a highly successful procedure that has restored sight to countless dogs, especially when performed early, before the cataract matures and secondary complications like lens-induced uveitis can arise. Understanding the causes, the risks of progression, and the available treatments allows us, as owners and veterinary professionals, to make the best possible decisions to protect the precious gift of sight for the dogs in our care. Thank you for listening. The titles for the referenced papers are in the video description. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.